Hello everyone, I'm Rashidian. I'm a PhD student at the University of Toronto and I'm currently conducting research on access to care for diabetes. So now we're going to focus on diabetes and see what OHTs can learn from the data that is provided to them using diabetes as an example. So we will be looking at 5 specific diabetes related indicators, which are listed here on this slide. So the first 3 of these indicators, patients up to date with HbA1c screening, patients that are up to date with retinal examinations, and patients that have had statins dispensed, these are related to diabetes management at the population level. They're not outcomes per se. And the last 2 of these indicators, we have hospitalization for long-term diabetes-related complications and proportion of patients with HbA1c levels greater than 7, meaning that their HbA1c is not under control. These 2 are outcome indicators, and they show us how patients are doing overall. So we will be looking at all of these indicators using an equity lens. And the marker of equity that we will be using is the Material Deprivation Index, which is based on Canadian census data from 2016. Basically, what this does is it looks at things like income, educational level, housing quality, and family structure. And it's closely related to poverty, it's related to access to care and patient health outcomes. And this data is split into quintiles. So in the Q1, which is the bright green, we have our least deprived neighborhoods, all the way to the Q5, which is the most deprived neighborhoods in the dark blue. So in this image, which is based on the most recent year of data, we can see all our OHTs stacked. And at the top, we can see that we have some OHTs that have up to nearly 40% of their population in most deprived areas, while at the bottom, this is less than 10%. So to summarize, what we see from the data is that overall diabetes management is moderate. 47% of our patients are up to date on their 2 HbA1c tests within the past year, 61% are up to date on their retinal screening, and 72% have received the recommended statin therapy. And what we saw, if you recall, we had a high degree of equity in these 3 population management, the screening indicators. But what we did see is that there were inequities in our health outcomes associated with diabetes, meaning that patients from more deprived neighborhoods had high hospitalization rates for diabetes-related complications, and they also had high proportions of HbA1c levels that were greater than 7, meaning that their diabetes is uncontrolled. So overall, in order to achieve diabetes management in our population, we will require new strategies to reach those individuals who are not up to date with their diabetes management. It's vital that patients access care, but we must make sure that the care that they are accessing is effective. And also, there's likely more to reducing diabetes complications than just diabetes management. Social determinants of health likely play a role in this, and diabetes management at the population level will require coordination across our different healthcare sectors. More research, my PhD thesis will look more carefully at the drivers of good and poor diabetes-related health and hospital outcomes.